Hi there, Dr. Kathleen Young, board certified child, adolescent, and adult psychiatrist, here to talk about less obvious presentations of um, autism spectrum disorder and neurodivergence in general. And I did a short video about repetitive behaviors, but I really want to kind of come back to that because I work with a lot of parents and they ask me about, what to do about certain things like phone use. I think scrolling is a repetitive behavior and people who are neurodivergent tend to be much more vulnerable to getting trapped in that cycle of scrolling for hours and hours and hours. I mean, the phones are addictive for all of us, myself included. And people can really get into it, but oftentimes scrolling is a way to deal with boredom when you're standing in line, or a way to kind of numb out or check out from a long busy day. And so I think a lot of people can relate to that. And so when you're thinking about taking the phone away or limiting your kids' phone use, you have to, and just in general, if you're thinking about limiting your phone use, you have to think about how are you going to replace that? What are you going to replace that with? Because just like going cold turkey isn't going to work. You need to think about the function that it serves. So when we think about repetitive behaviors or stimming in autism spectrum disorder, there often is a component to it that helps people regulate themselves. So regulate their nervous system when they get overwhelmed or overstimulated or overexcited or whatever, to manage emotions and cope with stress. And so if you're thinking about limiting one thing, you have to think about what you're going to replace it with, or it just kind of falls apart. Just telling your kid to stop using their phone doesn't work because then they have to have something to replace that with. And so it's important to brainstorm what are you going to replace it with before you change it. So there's that. And when we think about stimming, I didn't say this in the last video, but I want to say that stimming is kind of a repetitive behavior that's sometimes purposeless, but it serves the function of self-soothing, self-regulation, managing emotions, coping with stress, like I said. And so, we see all kinds of behaviors that do it. And so, since we're talking about less obvious presentations of autism spectrum disorder, that can be humming, tapping their foot or leg, twirling your hair, um, other kinds of behaviors that I mentioned in the other one, chewing, biting. I saw someone once who like plucked their hair with tweezers, doodling on a paper, rocking back and forth, spinning. And then, the things we think about, flapping your hands, banging your head, tapping your fingers. Those are all examples of stimming behaviors. And again, they tend to serve a function. They may be, enjoyable or soothing. And so when you want somebody to stop, you have to think about what will they do? And do they need to stop? But with phone use, they often need to stop. So because it can be hours and hours and hours. And so we want to think about that. Hope this helps. Um, it's not meant to be an exhaustive list, but just to get you guys thinking about this as it comes to yourselves or your kids.